Hello. Today I want to talk to you about some changes that have been put in place by the state and the Department of Health to ensure that you understand the process of this virus that is going to be coming through. We know the weeks ahead are going to be bad, and so in anticipation of that, we know that we're going to have to be limiting visitation when your loved one or if your loved one is in the hospital. And so we wanted to be very clear, and we worked with the Department of Health through the Hospital Association to ensure that it would be a very, very simple process. So it's, as you know, it's a stoplight, green, yellow, red. Green obviously means in the situation we live in today. Now, today is the situation with a pandemic, which means that you are allowed in, but there are limitations. We can't have people gathering in the lobbies. And if you are in the hospital, you must wear your mask, you must socially distance, even from your loved one, and you must continue to wash your hands and abide by all of the safety regulations that I'm asking you to live by in normal life anyway. Yellow means that we'll limit the amount of time that you spend with your loved one, that we are really going to be very strict about people in and out. Red is what you would expect. Red is lockdown, with the exception of end of life, labor and delivery, as well as those who are suffering from mental incapacities or limitations as such. So how will this work? The entire region of the state, meaning we're in Inspira, the southwest region. The entire region, all those hospitals will be under the same color code as this rolls out, and that code will be set every Thursday. Okay, so this week on Wednesday, there's an algorithm. It takes into account the county numbers. It takes into account the incident rates that are happening in the individual hospitals. It takes into account a variety of different mechanisms and then spits out a color that will say, okay, this is what we think is the safest to be able to move forward. And that will be posted on our website. There will be signs in each of our hospitals. And again, all of the hospitals within that Southwest region will live under that same categorization. Our goal is to make it easy. Our goal is to try and uniformly, as a health system, as well as hospital systems, be able to communicate to our patients and let them understand what they can expect and what indeed is going to go forward. We're watching the data. We know that this is going to get worse before it gets better. We talked about it last week. We've talked about it the week before. If we do not maintain all of the things that we've talked about, those numbers are going to continue to spike at record numbers. And as I said last week, it isn't about buildings or beds, it's about staff. And we, as others have done, have worked very, very hard to make sure that we can get contracts for agency nurses, which means that people come in from outside to be able to staff in this crisis. But the truth of the matter is the entire country is in crisis. So our ability to pull on others to be able to gain that staff is very, very limited, which is why we need to keep our staff safe and healthy. And I want to tell you about a nurse who works with us. Colleen Manning was first diagnosed in probably one of the first cases in March. Started out with a sore throat. She's an office manager in one of our, and a safety coach in one of our physician offices. And out of the abundance of precautions, she went home. And that's when also, not only was she confirmed with COVID, but she saw the worst of this disease. She has become an absolutely ferocious advocate, saying to me on the phone on Friday, I am going to do everything I can to tell my story, to share this over and over again so people understand this is for real. We want to make sure our hospitals are open and we want to have the staff there to care for you, as we always have. But in order for that to happen, we need you to be smart. We need you to not take chances. Again, Thanksgiving, we will have Thanksgiving memories. They will just be different. We need to not extend that family one more to people we do not know. And I know it's hard. The whole point of Thanksgiving is taking in others that we do not know and making sure there's enough for all. But this year, you can do that. Just leave the food at the door. We need our staff safe. We need them healthy. We need you healthy. And the fastest way we can all get to this is to be able to maintain social distance, wash your hands, and most importantly, to wear that mask. I wish you all the best this Thanksgiving season. And until we meet again, be well and stay safe.